Given the toxicity profile and given the overall survival data, the combination of gemcitabine and capecitabine is now the standard of care of adjuvant treatment following resection for pancreas cancer. The study involved recruiting 732 patients from 6 countries, including Sweden, France, Germany and the UK, involving some 92 sites. It was a straightforward one-to-one randomization, and because of good results, the study was closed a little bit early following complete recruitment, but before all the events, i.e. death, were obtained. The key findings were that there was no overall toxicity difference between the 2 arms. There were differences of toxicity types. For example, hand and foot syndrome occurred in the gemcitabine-capecitabine arm, not in the gemcitabine arm, but that was low. It was 7%. If we look at grade 3-4 fatigue in both arms, it was still very acceptable, and 5% for the gemcitabine arm and 6% in the combination arm. Nearly all the patients started and received treatment that were randomized to do so. So that was quite an achievement. In terms of survival, the median survivals were improved both for gemcitabine with nearly approaching 26 months and some 29 months for the combination arm. The overall survival, the hazard ratio, was 0.82, and this reached statistical significance. And the 5-year estimates were 16% for gemcitabine, as we've seen from previous studies, and 29% for the combination arm. It's important to bear in mind that we were dealing with a true population of patients, which makes the results immediately transferable to the general community. As expected, there was a reasonable median survival rate in the combination arm, the arm that included evofosfamide and gemcitabine, but the results were also slightly better than expected in the gemcitabine arm. So although the hazard ratio was 0.84, it just failed to reach significance. There was also a slight improvement in progression-free survival, and that was significant. There was an objective response rate that favoured evofosfamide and gemcitabine compared to gemcitabine alone, but again the gemcitabine group seemed to do particularly well, and that didn't quite reach significance either. It's an interesting study in that it was a prodrug. Evofosfamide is a prodrug that works in hypoxia, and pancreas cancers are known to be particularly hypoxic due to the poor blood supply that they have within the centre of the tumour. It is unfortunate that they didn't actually look at the markers of hypoxia within the tumour and try and relate results in that way. Of interest is that the relatively small number of patients that were recruited from Asia, the evofosfamide and gemcitabine appear to be superior, and significantly so. That's on the forest plot, and the study overall will need to undergo further analysis from that point of view.